Greetings everyone. My name is Tarussi Shailendra Singh, a third year E19CSE student of Bennett University, and in this video I'll be talking about pill camera. What is a pill camera? A pill camera is a small vitamin pill sized capsule that is used in endoscopy. It goes through the body, taking pictures, helping diagnose problems that previously doctors would have had to use surgery for. The medical term for this is capsule endoscopy. Now, before we talk more about parts and working of a pill camera, we need to know what exactly endoscopy is.
An endoscopy is a procedure used in medicine to look inside the body. It uses an endoscope, which is inserted directly into the hollow organ or cavity of the body, to examine its interior. Endo is Greek for within, while scope comes from the Greek word skopos, meaning to target or look out. An endoscope is an illuminated optical, typically slender and tubular instrument. The optical tubes of an endoscope are only a few millimeters thick and they transfer illumination in one direction and real-time high-resolution images in the other.
Now the question arises, why do we need pill camera? We need pill camera because traditional diagnostic tools are not only a source of pain and discomfort, but they're also incapable of providing direct visual access to small intestine. This forces doctors to use exploratory surgery for small bowel diagnosis, a method both risky and substantially uncomfortable for the patient.
Israeli inventor Gavril Edan was the first to come up with the idea of wireless capsule endoscopy. He then co-founded a company named Given Imaging to market his new prototype. His invention was initially released as M2A or mouth to anus, but was later renamed pill camera.
The latest version of a pill camera measures 11 mm by 26 mm. It weighs 3.7 grams and contains an optical dome, CMOS sensor, ASIC transmitter, LED array, lens and lens holder, battery, and antenna. Moving forward, we'll talk about all of these parts and their working in detail.
Optical dome is a non-conductive element of the capsule which represents the front of the capsule's shape. Its functions include liquid filtration and balancing of other enzymes. Lens holder. As the name suggests, it holds the lens firmly to the capsule to prevent detachment. Lens. The lens is the eye of the capsule and cannot be underestimated. It is one of the major parts of the capsule and is placed under the side of the optical dome. LED. There are several components that are made up of the LED. The end product of it is to illuminate light around the passage region of the body for easy identification of affected tissues. It also prevents reflection through the light receiving window. CMOS sensor. This is the beauty of the capsule because it detects minute objects as less as 0.2 mm and works on a precision of 140 degree. Battery. The design of the battery makes it harmless to the body. It is made up of silver oxide and is in the shape of a button. There are two batteries in a capsule so that the capsule lasts for the entire period of examination. ASIC transmitter. It is an integrated circuit which helps the facilitation of images captured. It has two electrodes isolated electronically. Antenna. The communication existing between the belt receiver and the capsule is made possible with the help of the antenna, which is coated in polyethylene.
The working procedure of a pill camera is that once it's swallowed by the patient, it goes through the body, capturing images of the internal organs and sending them to a sensor belt worn by the patient across their waist. This belt's antenna receives the images and records them in a recorder. The doctor can later on view these images or even in real time using a real time viewer. The pill then flushes out of the body within 24 to 28 hours. A pill camera can be used for the diagnosis of Crohn's disease, malabsorption disorder, tumors of small intestine and vascular disorders, ulcerative colitis, and medication of small bowel injury.
The capsule endoscope is capable of non-invasively passing through the body, which is the clear distinction from traditional endoscopy. This makes it painless with no side effects or complications. Conventional endoscopes are also limited in their usage range. Usually, they are able to visualize only a small portion of the small bowel. The capsule endoscope, however, due to its small size, is capable of imaging the entire gastrointestinal tract. They are also accurate, precise, effective, and have a lower power consumption. They capture and send high quality images to the recorder almost instantaneously. They are made up of biocompatible material, so they do not cause any harm to the body. In fact, the biocompatible material goes as far as to prevent the capsule from rupture. It is not possible to control the behavior of the camera. Further, the pill may get stuck if there is obstruction. However, both of these drawbacks can be overcome by the use of a bidirectional telemetry camera. Due to risk of obstruction, patients with gastrointestinal structures or narrowings are not good candidates for this procedure. This can be overcome using another product manufactured with the help of nanotechnology, which is the size of a rice grain. In under 2% of examinations, the patient retains the device. This is yet another downside of capsule endoscope. Moreover, the lack of locomotion within the device makes it difficult to investigate points of interest for extended period of time.
The capsule endoscope has seen significant progress within the past 20 years. Still, it shows great potential for future improvements, amongst which is device mobility. Enabling guidance of the capsule throughout the patient could allow for targeted investigation. This functionality could also open the possibility of direct drug delivery to areas of interest. Externally controlling the capsule would also help reduce the overall power consumption of the device. The power saved from externally controlling it could then be used to improve functionalities such as image collection and transmission.